Opioids, the basics. Key terms: opiate, any drug from an opium poppy; opioid, any drug which binds to the opioid receptor. How do opioids work? Opioids are drugs. Drugs bind to receptors, in this case G protein coupled receptors. The names of receptors are 4 different types: mu, delta, kappa, nociceptin. Mu can be class 1 or 2, and these are based on the first agonist was morphine. Delta, the first site was ephastephrons, and kappa, first agonist was ketocyclazine. Where are these receptors located? They could be neuronal or extraneuronal. Extraneuronal, bowel, knee, heart, testes. Neuronal could be direct effect or inhibitory pathways. Direct effect, so they block the activation of the ascending neuronal pathways. These could be in the peripheral nervous system, spinal cord, brainstem, medullary cortex, or they could enhance inhibitory pathways, preventing neuronal propagation from the peripheral nervous system up to the cortex. Examples include the periaqueductal gray and locus coeruleus. How does it do this? These are G protein coupled receptors, the GI inhibitory G protein coupled receptors. Receptor binds, or the opioid binds to the receptor. This prevents the activation of adenyl cyclase, activates potassium efflux, and inhibits voltage gated calcium channels, resulting in hyperpolarization of the cell, preventing the propagation of the neuronal action potential. Classification. So opioids can be weak or strong. Weak opioids include codeine, diacodeine, tramadol. Strong opioids include morphine, fentanyl, diamorphine, methadone, oxycodone. Opioids can have a range of different side effects. These side effects can be classified in a system-based approach. Breathing. Opioids receptors are abundant in the respiratory centre, supracortex, thalamus, and mechanical receptors, and therefore activation can result in reduction in respiratory rate, tidal volume, leading to hypoxia, hypercapnia. Cardiovascular effects. Opioids can have direct myocardial depressant effects, reduce SVR, which may be histamine related, and also cause vagus mediated bradycardia. CNS effects. Opioids cause sedation, euphoria, dyseuphorion, and small pupils via activation of the AWN nucleus in the brain. Endocrine effects. Opioid receptors in the HPA axis reduce ACTH levels and therefore cortisol, and also lead to inhibition of GABA release, which enhances ADH release. Musculoskeletal. Opioids in some instances can cause muscle rigidity, GI. Opioids can cause nausea and vomiting by activation of mu receptors in the CTZ, and also constipation by reduced intestinal secretion and motility, urinary. Opioids can enhance Chewy's activity, cause urinary retention, and finally dermatological and cause pruritus.